Hey folks, my name is Philip Chan, one of the medical directors here at the Rhode Island Department of Health. Pleased to be here today to chat a little bit with you about the vaccine implementation here in the state of Rhode Island. As many of you know, we finally have COVID-19 vaccines here in the state, which have been reviewed by the FDA and given guidance by the CDC. Very exciting. I really firmly believe that this is the end, beginning of the end of the pandemic. And I want to share some information with you all about how it's going and a little bit background about these vaccines as well. I know there's been a lot of concerns, questions raised reasonably, but I want to address some of those here today and to give folks a little bit of a background about what these COVID vaccines are. So let's start first about what is a vaccine. So vaccines really are one of the most exciting, important, critical aspects of how we address public health here in the country and the world in general. Vaccines are responsible for really eradicating and controlling a number of infectious diseases across the world, things like smallpox and polio, pneumonias, etc. They really have been one of the most critical advances of our times in the last 100 years. So how do vaccines work? Essentially what vaccines involve is administering a little piece of either a virus or a bacteria to a person, a piece of the virus or bacteria that's not live, that's not going to cause infection. And what happens is that allows a person's immune system to respond. And a person develops an immune response that allows a person to fight off that virus or bacteria should they ever be exposed to it. And the way that a person fights off infections in general is through the development of antibodies. So antibodies are sort of the basis for our immune system of how we respond to different infections in the world, in our bodies. And what happens is, right, if you think about it, viruses and bacteria are so small, they're much smaller in general than our cells and certainly the other parts of us. And what happens is these viruses and bacteria, when they come into a person's body, they're comprised of all these different parts, right? Little subunits, little components, and these little components are called antigens. And so normally what happens in a person when they're infected by virus or bacteria, in this case SARS-CoV-2, the virus that causes COVID-19, is that your body breaks down some of these viruses into these components. These components are known as antigens, and you develop antibodies, immune responses against these antigens. And so that's how a vaccine works, is it takes these little pieces of viruses, of bacteria called antigens, and you inject them into you, and your body makes this antibody response so that if you ever see the virus or bacteria in real life, you'll have immunity to it already. And so that concept, it seems so simple, but that concept is really what has generated now dozens of different vaccines for a multitude of different infectious diseases. So think about COVID-19. So at this time, there's two currently approved COVID vaccines, the Pfizer and the Moderna. Both of them are known as RNA vaccines, mRNA vaccines. And so what's an RNA vaccine? So basically what these vaccines do is they take a little bit of genetic material of the SARS-CoV-2 virus that causes COVID-19, and it's injected into you. Now, to be clear, this is a very small piece of the virus. It's not the whole virus. It's not even all the genetic material. It's just a little subset of that genetic material. And so that little piece of the genetic material of the virus, what happens is your body takes it up. It actually codes a small protein or an antigen of the virus, and your body develops an immune response against that. And the specific part that it codes for is known as the spike protein. And the spike protein is on the outside. If you think of the virus, right, as a circle or a sphere, the spike protein is on the outside of the virus, and it's a spike protein that actually attaches to and infects cells. So basically what happens is you get all these antibodies in your body, and they essentially attach to that spike protein and neutralize the body, neutralize that protein on the outside of the virus. And that's how it works. So I think importantly, some of the questions that we hear about, does this vaccine alter your DNA, et cetera? So this RNA never enters the nucleus where your DNA is kept. It does not interact with your DNA, et cetera. So these are incredibly safe vaccines. They've been studied in tens of thousands of people. And in fact, now at this point, both of these vaccines have been administered to millions of people, including tens of thousands here in the state of Rhode Island. And we're not seeing anything unusual. So what we normally see is that people have a reaction. I myself got this vaccine in the first 24 hours. I had fevers, low-grade fevers, mild fevers, some chills. I felt tired, had some body aches, my arm hurt. And this is normal and expected. And it actually shows that your immune system is developing those antibodies to fight off the virus should you ever see it. So normal reactions, we haven't seen anything unexpected. Some people may also see in the news is that there's a very small, rare subset of people that actually have allergies against this vaccine. So if you have an allergy against the vaccine, a known allergy, or you're allergic to any of the components, and all the components of these vaccines are available online. You should talk to your physician, another medical provider. But if you have any allergy to the components, you also shouldn't get the vaccine. There's also people, of course, that have lots of allergies to other things. And we do encourage you, if you have any concern, to check in with your medical provider. But allergies to other things, whether or not they be medications or food allergies or pet allergies or seasonal allergies like I have, are not a reason that you should not get the vaccine. They're not a contraindication. It is encouraged that you talk with a medical provider, you want to be sure, et cetera, but it's not a contraindication to getting the vaccine. But good, always good to discuss with your medical provider. So the other thing is that these vaccines are given that they're a piece of the virus, there's no way that they can actually cause active infection. And that's another question that we're getting as well. There are some vaccines out that use the full, the entire virus, the entire bacteria, but there's really no way that these vaccines could ever cause active infection because it's such a small subpiece. So that's another sort of piece of misinformation that we're hearing about. The other thing, too, to consider is that even people that have had or tested positive for COVID-19 in the past, we are still encouraging people to get the vaccine. There's a huge spectrum of infection and disease that this virus causes, and it is recommended by the CDC and us here at the Department of Health that you should have the vaccine, even if you've tested positive in the past. And the way I think about it, right, is that you had the infection initially, you may have some immunity, and this vaccine really is meant to make sure that you have immunity, and also in a lot of people who may not have developed immunity the first time around. So those are some of the concerns we have. The other thing that sort of comes up, and the fact that this may have been rushed through, and I just want to encourage people, the studies for both of these vaccines are now published, widely available online. You can look them up yourself. But these vaccines really did go through the same rigorous review process as any other vaccine in the history of vaccine development. And what I like to remind people is that there's no vaccine that has undergone more scrutiny, right, than the COVID-19 vaccines. I mean, everyone's looking at them, everyone's reporting on them, and so if there were some unusual side effects or other things out there, we would surely have heard of them by now. But I've been really reassured. Again, millions of doses administered, tens of thousands of people in the initial studies published online, millions of doses administered, and people generally are doing really well, myself included. The other thing I just wanted to touch on, and we've gotten a lot of questions about this, is how's vaccination going in Rhode Island? So I do feel like here in Rhode Island we are doing well. We've been one of the top states in terms of vaccinating people, getting vaccine out the door. The logistics and the process of getting vaccine out to people is incredibly complicated. And the way I like to think about it too is, we have to vaccinate 1.1 million people. That's the population here of Rhode Island. We can't have them show up all at once, right? Because we're trying to avoid crowds, of course. You want to maintain 6 feet, a mask, et cetera. So it's an incredibly complex process. Also keeping in mind that these vaccines come in vials, packages that have between about 975 to 100 doses per package. And so we want to make sure that no vaccine is wasted, right? Obviously, we're in short supply here. So we want to make sure it's packaged and distributed in a very efficient manner so not a single dose is wasted. And here in Rhode Island, we can confidently say that the doses for this vaccine have been maximized. There's been no wasted doses that have been used. So I do feel like, in general, we're doing a pretty good job here in Rhode Island. I think the elephant in the room, though, if you will, is that we just don't have enough supply. And if I could wave my magic wand, of course, everyone would have access to the vaccine. And that's our goal, and we're getting there. we're vaccinating about 14,000 people a week here in the state of Rhode Island. But to put that in perspective, right, that's about 1.5% of the population. So not a whole lot, but a subset. And we've had to start, of course, we're basing our decisions both on what the CDC is telling us, both on our own statewide vaccine subcommittee comprised of community members and physicians, et cetera. And we're prioritized, for example, in our first phase, physicians, healthcare workers, other medical providers who are taking care of people who have COVID, some very fragile folks, patients, people who are at risk, immunocompromised. And we also need to shore up our healthcare system. One of the things that we've learned in this pandemic, and we've seen it in other places, is that the risk of dying or having severe complications is certainly from the virus itself. But in places where we've seen the healthcare system overwhelmed, where healthcare workers have gotten sick, died, et cetera, is that also increases the risk of people dying because they can't get the medical care they need. So it was recommended by the CDC here in our state, et cetera. We've prioritized the healthcare workforce to receive this vaccine. And then as a close second, we also prioritize nursing home staff and residents as well. As we've seen during this pandemic, older individuals, folks over the age of 65 and certainly over the age of 75, are at significantly higher risk of having significant complications from COVID and dying. And so that group has been prioritized here in Rhode Island, across the United States, as well as the people that work with those individuals, i.e. nursing home staff, et cetera. As we move forward in our process here, we're also going to prioritize, other aspects of the healthcare setting, dentists for sure, pediatricians, outpatient providers. We're also going to prioritize individuals who are 65 years of age and older. We're going to start with those who are 75 years of age and older because they're at significantly higher risk. We eventually want to get to all individuals 65 years of age or older, and also those with other comorbidities. And one thing that we've seen here, with COVID-19, both here in Rhode Island and elsewhere, is that people who have comorbidities, meaning other healthcare conditions like chronic lung disease, chronic kidney disease, chronic liver disease, are at significantly higher risk of having complications of COVID-19 and potentially dying. So we definitely need to prioritize that population as well. So we're moving through the list. It's been complicated. Again, we're only able to vaccinate about 1.5% of the population every week. We're getting input from lots of different people as we make these decisions. But at the end of the day, what it comes down to is that we are getting there. One thing I've just been asking people, the Department of Health, have been asking people is to have a little bit of patience and flexibility with us. I think the one thing, again, is just the short supply of this vaccine for people in general, the country, our state, the world, but we're getting there. And I think, some of the things we've been hearing in the news is that the manufacturing processes have been ramping up. We're also very optimistic. There's 2 other vaccine candidates on the horizon. There's the AstraZeneca vaccine. There's the Johnson & Johnson vaccine. So I remain really optimistic that the timelines that we have set, the way that we're rolling this out, will only continue to improve as we understand more about these vaccines, about the virus, and as other vaccine candidates come out. I do want to just mention to people that even if they do get vaccines, is that we still need to mask and physically distance. We do know that these vaccines are incredibly effective against preventing disease and people getting sick. One thing that we don't know quite yet is how well these vaccines work against people getting asymptomatic infection. And we're going to know more in the very near future, but what the CDC is recommending and what the Department of Health is recommending is that even if you get the vaccine, is that you still want to mask and be careful and physically distance and follow the other public health guidance that we've released. We hope that will not always be the case, but until we know more, that's what we're recommending. And people in general, certainly people without the vaccine, I know it's been a long ride. We've been at this now for almost a year, but just asking for people for a little bit more patience as we get there. I'm very optimistic that we've been in this terrible second wave. Very optimistic, though, that we are things are improving, and that hopefully by spring or summer is that we'll be able to relax and at least have some degree of normalcy moving forward. So I want to thank everyone on behalf of the Rhode Island Department of Health. Please do reach out to us with any questions or concerns, but keep up the good work, and thank you again for everything you're doing.